depends on the nutrition as well. And this nutrition also starts before birth, if I'm not wrong.
Yes, it starts from the womb.
And how are disabilities caused?
In the womb problems when the mother is pregnant, or maybe child did not cry at birth.
So one shocking information I got today is not crying at birth can lead to illness.
Yes, that is the most important thing. Autism right now, our knowledge is autism is a neurodevelopment disorder. So neuro means something to the brain, and development is something that hampers the development of the child. Now what kind of development it is hampering? When your parents, my parents' time, how was the situation at home? The house was filled with people, so many people that even if somebody had the genes for developing an autism, they would come and pull your cheeks, oh my golu molu, that kind of thing, and they would do something and try to give him more time, and then somehow he will catch up. So if you ask me, the current statistics, the US says 1 in 33 is autistic.
If you want to know the future of a country, don't look at its GDP numbers, but look at the health of its children. According to World Health Organization, almost 17 to 19% of the world's child population belong to India. And as you know, India is the world's largest population. I have Dr. Jason with me, who's a pediatrician. Welcome to the podcast.
Thank you very much.
How do you all categorize children medically? From what age, even before birth and after birth? And where does the role of a pediatrician start, maybe from gynecologist to pediatrician, and where does it end to the other doctors, like a general medicine practitioner or something like that?
So I'll answer your second question first, and that is, where does the role of a pediatrician start? It starts from birth till 18 years of age, from 0 to 18 years of age. Now, when some births can occur term, that we say at 9 completed months of pregnancy, some can occur preterm, that is less than 9 months of completed pregnancy. So that the initial that we say, the first 1 month is called as neonate. The child will be labeled as neonate. From 1 month to 1 year, we call them as infant.
Neonate and infant.
Yes.
0 to 1 month is neonate.
Correct.
And 1 month to
1 year is infant.
1 year is infant.
So 1 year to 3 years, again we call them as toddlers.
Okay.
That's the term that we give, toddlers. And then we call them from 3 to 6 years as preschoolers, and then school going. So more than 6 years. So basically, and then after 10 years is where the adolescence begins. So 10 to 18 years is the adolescent age group. So this is how we broadly categorize children as per age.
Neonate to adolescence is what you take care of.
Yes, absolutely.
So now, in the Indian scenario, what are the most common illnesses that kids come to you with? And how can this be avoided? I know it cannot be avoided 100%, but what can be done to see that it's avoided as much as possible?
The most common illnesses are usually that we say the cough, cold, fever, respiratory tract infections. Along with that, diarrhea, vomiting. So as per the age groups, we can see maybe the less than 1 year olds may most commonly present with some diarrhea or some maybe a cold cough things. And where all the older age group may present as they are exposed to new food, these things, so they may get more of a diarrheal illness later. So these are the most common illnesses what we commonly encounter in our pediatric practice. Yes, and along with that, it will usually be something related to the growth. The child is adequately growing according to the age, or something with the development, where the child is attaining the milestones as per the age or not.
Developmental delay, as you call it in psychology.
Yes. So for every when we say as the age goes in, if you take account of the x-axis, there is some amount of milestones that the child should achieve at that particular age. Unlike other animals, we are not completely well formed. Our brain is not completely well formed till 9 months of age. You can see an elephant that gives birth immediately, and within a matter of 30 seconds, the baby will just stand up and walk. Literally, when you see that on the human side, we are completely till the next 1.5 years, we are absolutely useless. We can't walk, or we can't even walk by ourselves. So we are always dependent.
Yes.
So to achieve that amount of stage, there's some amount of development that occurs. So at this development, if there is any delay, it will be called as development.
You call the toddlers useless, but they can't understand my podcast, so it's okay. All right. And like I asked you, my other part of the question was, how can we prevent these common illnesses? Like, it could sound silly,
Yes.
but like you said, these are the most commonly occurring illnesses: diarrhea and whatever else that you mentioned, the lung related,
Yes.
respiratory tract related
Yes.
illnesses. What are the precautions that can be taken? Because India, especially, is a highly polluted country in terms of air and water,
True.
if we see, because it's still developing and there's a lot of concrete dust and other things happening. So what are the ways we can prevent, the common man can prevent this?
Absolutely. I like the way how you put it, as how we can prevent, because we as general public has to take responsibility for every child, not just my child or your child or something like that, but all the children around us are our responsibility. If tomorrow they're getting some infection, is because of us not maintaining all these air quality, or maybe the soil quality, or maybe the water quality, that we have completely polluted and completely made it a very bad world to live in currently. So, but what are the other things that you mentioned that we need to take care to prevent some really bad infections? Is very common. First is a good food, good sleep, good nutrition, and adequate rest. So these are what is required. Along with that, some really good hygiene practices and timely vaccinations. So immunization and vaccinations that we say is what is required to build a good immunity in these children.
In one sentence, if you can, tell me the difference between good and bad food, how would you
Okay.
term it?
Good and bad food.
Yes, the
Okay.
difference between good and bad food. What
So,
what defines each?
what
Yes,
defines?
because we have a
Yes,
lot of
yes,
options now, and
correct,
the lines are blurred as to what is good,
correct.
nutritious food and not. That's highly questionable now,
Yes,
given the genetically modified food, and plus a lot of pesticides are sprayed and all of that.
yes.
But regardless, let's just maybe consider or not consider that. But how would you, as a pediatrician, bifurcate good with unhealthy
Okay.
food?
Anything that is not, I mean to say, that is outside home cooked food.
Oh,
Home cooked food is a very nutritious food, and then whatever, as per the age you see, less than 1 year, we don't advise them to take a lot of sugar and salt because of the kidneys being immature and these kind of things. But this good food is basically that what is naturally available in the food. We need to say some food has natural sugars, some food do not have some natural salts, maybe you can think. So mixing these two foods gives a nice taste for the food. So home cooked food generally brings out that thing. And whatever is home cooked food is always nutritious, is always good and fresh. Eating fresh food daily, not taking it, keeping and reheating and rewarming and again,
okay.
or anything that is fast, quick, quick, deep fried, all these things. Eating it on a daily basis is again bad food. So some amount of vegetables, some amount of fruits, and that will all make a balanced diet. So that is what is
So
good food.
mainly something with natural sugar and natural salt.
Better.
All right. So now we see, because of more awareness, certain parents are hyper aware or hyper protective of their kids. Sometimes it also goes to paranoia. Just if they cough, probably they
Correct.
take leave from school, and then it's a big fuss created for good reasons. But do you think, at the same time, on the other hand, there are these nomadic people in India who travel from one city to another? The kids are just rolling on the streets, but we don't see anything happening with them. So, is it about being open to these natural environment which is increasing the immunity, or how do you see the difference between these two categories? Who has more illnesses? Do we not know illnesses of the nomadic people or the poorer income groups? Do they not come to the fore? Or, and it's also related to my other question of how to increase and how do we decrease our own immunity?
Yes. So as you mentioned, there's a very good question. But thing here is, we are really the thing that the nomadic people have good immunity is a myth.
Oh,
Basically, that's not the way. Because for to develop a good immunity, our body definitely needs an exposure. Definitely, they have a wide exposure of all these viruses, the illnesses, and all that thing is there.
sunlight and
Sunlight,
soil
there's a
and
good exposure to them. Definitely compared to the over pampered kids who are inside the rooms, and even if they cough, and as you mentioned, parents get paranoid. That is definitely there. The exposure is wide. But that exposure, how much of an immunity will the child elicit? For that immune response to elicit by the body, the child requires to have good food, good nourishment, and good sleep and adequate, well-being, the overall well-being of the child should be good to elicit a response. Now, the mere process of vaccinating, we give the exposure to the child. Now, how much of these vaccines, how much of an immune response the baby generates or maybe the child generates is left to that baby per se. So, this immune response, whatever is supposed to come, it depends on the baby's nourishment, nutrition, overall development.
So you're saying on one hand it's exposure and on the other hand it's nutrition,
Yes.
two ends of the spectrum. And what
Yes.
vaccines do is they give the exposure.
Exposure. So,
Okay.
how much of an immune response a baby generates, it depends.
It depends on the nutrition as
Yes,
well. And this
yes.
nutrition also starts before birth, if
Absolutely.
I'm not wrong.
Yes, it starts from the womb. Because from the first day, it's a life, no? It's all in the making, it's all developing.
Still
So,
feeds.
still
Yes.
there, yes. It's just everything is a genes, everything is in genetics.
So my next question is linked to disabilities that you mentioned before the podcast with me personally. Is there any cause for disabilities or do they happen by chance? Which is also linked to another question of, I've heard that according to medical science, they do not um, encourage marriages within family. And because they say it leads to health complications. How far is that true?
Yes.
And how are disabilities caused?
So, disabilities, as you mentioned, is something that the child is not able to do. A uh, functionally, the child is not able to be capable of doing some act. That time we label them as disabilities. Now, this can be related to any of our senses, maybe our vision, so visual disability, maybe our hearing, so that hearing disability, or maybe our speech, that we can't speech part, or maybe our intellect, that intellectual disability, any of our special senses which is not functioning as per required for a smooth functioning of an individual will result in disability. So we have a lot of parameters on that. Now, why does it happen? So why does it happen? They can be, as you mentioned, in the womb problems when the mother is pregnant, during the development of the child, or later on, maybe some child gets some infection in the brain, or maybe child did not cry at birth. So when a child cries at birth, that's the first start point of the baby's engine. No, when the baby heart starts beating, all that blood goes around the entire body to all the organs. So this is the most important kickstart that the child requires, such that the baby's body engine, what is there, it needs to function very well. So maybe some problem there, or later on maybe because of some infection that the child is unable to see, hear, a lot of problems. So it will result in some kind of disability. And as you mentioned, some part of genetics also is there. So when marriages happen within the families, this consanguinity that we say will result in some common genes being there, and these genes can get mutated. So somebody has a disease, some blood related diseases run in the family, and if this mutation carries on, so the offspring is also going to continue having the same disease. So that's why consanguinity generally leads into some uh, neurodisabilities or some blood related disorders that are most commonly seen. That's why we say this possibly a chance being there.
And what about life threatening illnesses like cancer? Does that also come under this? Or is
Yes,
it?
there can be a possibility with the genes part for the cancer also to develop, but it requires a lot of epigenetics also, meaning to say what our environment and what our environment's role is there on the genes. Supposedly, our lifestyles is all completely, we are just very careless about our lifestyle, not eating good food, not having a good diet, not having a good rest, sleep, a lot of stress. These genes can get mutated, and then we can have cancer also happening.
So one shocking information I got today is not crying at birth can lead to illness.
Yes, that
Okay.
is the most important thing. A child has to cry at birth.
It's not just a sign, but the cause of illness, disability.
Yes, if the baby does not cry at birth, we will have to cry our life long.
Okay.
Because
Throughout our
when you see
lives.
the, yes,
Yes.
throughout our lives, because when you see the baby at the delivery room anytime, baby cries there, we all will be happy.
You all will laugh
Why?
with joy.
That's the only time we'll be like that. Later on, if as the child grows, anytime the child grows, we'll also, if the child cries,
We
we'll
too
also
cry.
start crying. But only time when the child cries we'll be happy is at the birth. This is because of that. The child has to be active, thriving well, moving all four limbs, crying out of its lungs out. is because that amount of blood circulation is required all the organs of the body.
Vital
So
organs.
that is happens.
So, what are the different vaccinations or injections that children need, which could be either mandated by the government or optional?
Government serves about 11 to 12 diseases which are vaccine preventable, which are given
Okay.
free of cost by the government, uh, Indian government per se. And apart from these, there are about 5 other vaccines that are not generally covered in the national immunization program, but has to be compulsorily, preferably given to the children so that they can at least protect them from the life-threatening diseases.
So, these five are optional,
Not optional, recommended. The moment when we
recommended.
say optional, it
Okay.
becomes just not required kind of things.
Casual, yes.
Yes, these are recommended because the only way to protect from the diseases is to get exposed to it. And how can we get exposed to it is by getting a vaccination.
So, we'll first cover the optional vaccines. What are these? If you can tell me the disease it covers.
Yes, the optional vaccines, if I should be specific, there'll be firstly is the pneumonia, the PCV vaccine, the pneumococcal vaccine that we say. It covers PCV 13 and such things are there, which are again not covered in the national immunization. Along with that, there is hepatitis A, then there is typhoid vaccine, then there is the HPV that we say, that is the for
Uh,
the yeah,
yeah,
the cervical
human.
cancer one,
Yes, yes.
that one. So similarly, like this, there are about 5 to 6 diseases. What's the optional vaccines recommended by the government?
HPV, I think, is for both males and females.
Yes, yes,
So, it's
yes.
a sexually transmitted illness, or
Yes, that
what
is
is it?
that is one thing that is definitely known, the human papilloma virus, which are generally going to cause a cervical cancer in the
Oh,
women. So if that's what we advocate for our patients, if you have a sister or you have an auntie or you have a mother, the per se, one important life-saving something that you can give is a HPV vaccine because it is sure shot going to protect you from cervical cancer.
and for males also, is it recommended for some
It
other
is, yes,
illness?
yes, it
Yes,
is
because
given for the
HPV, I
warts.
think, is for both.
Yes, for males and women, we can give it for the warts. For the male, generally, it's for the warts.
Okay.
So less than 14 years is one dosage, and more than 14 years there are dosages
And
different.
what if the person is above 14 and wants to take it?
Yeah, who is more than 14, we give them 3 doses. So as per the schedule, we give them 3 doses. Who are less than 14, we give them 2 doses.
So, what's the maximum age where they can apply? I mean, take this
They can
vaccine
give any time.
at any
Yes,
age.
yes, yes. That is best given when it is the the pre I mean the when the child bearing the before the first
Pre-puberty.
sexual activity. It's always recommended before that.
Okay.
Yes.
So, the recommended vaccines are done. Now, what about the mandatory or the compulsory vaccines?
Yes.
Which diseases do they cover?
Yeah. So the government what they uh, protects is from most commonly is the diphtheria, pertussis, tetanus, BCG from tuberculosis. Then we have the mumps and measles and rubella. Mumps doesn't cover. Mumps actually is again an optional. I mean the recommended vaccine that
Recommended.
comes under that. And then we have these are the things that generally this.
Autism, so we see a lot of cases of autism happening. I myself know quite a lot of people whose children have different, in the spectrum, different levels of autism.
Yes.
You may not be the right person, maybe, to answer this question of who will look after the kids after their parents, die. That's the main concern the parents have. I don't know if it's something you look into, because it goes more with social work and all that.
Yeah.
But still, my question now, after disabilities, is how is autism caused? Because some say it's because of medications taken during birth, before birth by the mother, or because of some stress factor involved. But I'm clueless about it. But it's quite
Yes.
disheartening to see this happening on a large scale right now.
Okay.
Or
So we know autism right now. Our knowledge is autism is a neurodevelopment disorder. So neuro means something to the brain, and development is something that hampers the development of the child. Now, what kind of development it is hampering? Is because of social communication and language development, one of the domain, and second is how the child interacts with each other, and some kind of with the movements. So these, if I tell it like this, obviously you will be confused and maybe the viewers will be confused and how what exactly is he talking is kind of thing. But when you observe these children, one thing is very common is that these children are more to themselves or maybe
isolated
isolated. So what my teacher used to say is they are more in the object world than less in the human world. So
in the
Dr.
emotional world, less in
Yeah,
the
they are not in the
emotional world.
human world; they are in the object world. Dr.
Okay.
Samir Dalwai is my teacher who on this neurodevelopment disorders. So he would use the word called as Manushya Magnata. Less of Manushya Magnata, more of Vastu Magnata. So they are, you can see them, they'll be more in the object world, lost with themselves.
They're obsessed with
Obsessed
moving
with. Yes.
objects,
So
I think.
because moving objects, these are all having patterns. So
Okay.
anything that has patterns, they'll be observed, they'll be, I mean, in that world, the
It could
pattern
be
world.
swings in a playground or
Yes,
a
everything is
fan or
happening
anything.
to and fro, and there's no what's happening. Now, even if the TV that you on, there's a rhymes coming, there's a song coming, they exactly know what is coming next. That pattern is there. After this word, this is going to come. After this song, this is going to come. The rhymes. With regard to the other moving objects, as you mentioned, train, all these things, there's a pattern. So they'll be in that kind of patterned object world, and no much of human world. What are humans supposed to do? Humans are supposed to interact. Humans are supposed to talk to each other, learn the behavior, know how to behave where, how not to behave where. That is what humans are supposed to do. But these children will not be able to do that. So this is also one of the disability, neurodisability that we say. And as you mentioned,
Causes.
what causes this thing? So this cause is mostly genetic,
Okay.
but more than genetic is the epigenetic. Now, as I mentioned, as a child is born in our human world, child basically doesn't know what is happening. Just born in neutral world. It just keeps crying, crying, crying. And then mother comes and feeds. The baby to realize that this is his own mother only takes 3 months. That is called a social smile. My child will look into the mother eyes and smile. And as the child development goes further, the child will know when to cry. That is only when the mother is around 5, 6 months. Baby will look around and see, okay, my mother is there, I'll cry now. That I'll know
Oh.
how he'll respond. That's when you'll learn the behavior. So this is a very dynamic thing that keeps happening, and slowly it'll know how to behave. So that's a step-by-step
For a
process
normal
for
child.
a normal child. Supposedly, this step-by-step process that doesn't come on what we say. It doesn't happen on track,
Developmental delay as
or a delay or
the
a deviance
technical.
that we say,
Okay.
a developmental deviance that takes
Deviance.
place,
Okay.
that will result in autism. So when we don't give much of human engagement initially,
Okay.
when the children don't get much of human engagement and just get object engagement, they will learn that behavior and they'll not know how humans behave or how human world develops, especially in part of social communication and language development domain. In terms of child development, there are a lot of domains. The gross motor, we say, where the child will sit, stand, walk, which objectively we can visualize and see how they sit, how they stand, what time they'll run, walk. It's all step by
The
step that happens.
larger movements of the
Larger
body.
movements, and then the finer movements also, how they take, how they point, and then how they take in the spoon, eat. All this thing is visible to our eyes, but what is not visible is our social communication, our language development, which is very subtle. So in this domain, which is the first step, is if we ask, is the human engagement. Child should engage with humans. Child should look at the mother, smile. Then child should know where the mother is, how to respond, such kind of thing.
So the thing I heard you say is that a child can be normal at birth but could develop autism symptoms because of
Yes.
lack of
Yes.
not care, I would say, lack of attention,
Human engagement.
human engagement.
Less of whenever there is less of human engagement, this is what happens. I mean, that's what I told. When your parents, my parents' time, how was the situation at home? The house was filled with people, such so many people that even if somebody had the genes for developing an autism, they would come and pull your cheeks, oh my golu molu, that kind of thing, and they would do something and try to give him more time, and then somehow he will catch up. So when we were going to school, probably there were some or two, three people in that domain or spectrum, which automatically joined back to mainstream school, and they were along with us in rest of the life. They were part of the normal curriculum. But nowadays, as you see, where the families are becoming very nuclear, no much people interaction, they are to them isolated. There is no grandpa, grandmother, nobody is around. Even the neighbors don't speak to each other. There is, for a human to thrive well to its best potential, they have to have a society. We have to have a society, and we have to interact with each other. That's the time when we thrive to our potential, to the maximum potential. When this doesn't happen, and we isolate our kids, what do? They'll be in their own world, they'll be to their object world, and at the initial crucial years of life where they're supposed to develop normally, this is where they go into a deviant. So what, if you ask me, the current statistics, the USA is 1 in 33 is autistic. 1 in 33 children. In India, they say 1 in 60 children are autistic. It was never there like that.
But what is the proportion anyway to know people, children who are autistic at birth and then later turn autistic? What is which is higher according to you?
At birth, you mean to say?
Yes, I mean from birth,
Yes.
children who are autistic and those who turn autistic later because of lack of social
See,
connection.
as I mentioned, if it is genetic, there's some genetic causes there. It may, but nothing is proven that, or nothing is, we have not proven that this genes is there. If you have this genes, it's definitely your child is going to be autistic. Nothing like that. A lot of genes have been found to be associated with this
But there's
autism.
no hard proof.
No hard proof. So nothing that you can say this child will be autistic at birth. But it's a developmental disorder, no? So as a child develops, we need to observe. Now you see a less than 1 year old child who's not looking into your eyes, not having an eye contact to you, not smiling at you back when you smile at the baby around 3 4 months later, or maybe when the child is 9 months, when you show him some camera or some object that way, or a book or a pen, the child doesn't look at the book and then again does not come back and see your face, how you react to it. So that kind of joint attention, that is not there. These are all subtle clues where the child can be going towards autism, going towards
Okay,
that lane.
okay.
But generally, what happens is people think it is just a speech problem, and they most commonly present at around 3 years, saying that my child is not speaking well. Only when we go further into and probe, we see that there are already signs and symptoms were there much before that.
Okay, are there the last question, and I would like to keep it short. What are the other signs where you can observe that the child is probably showing symptoms of autism,
Okay.
and who are the people associated who can help the child develop later on? What is the help that they can receive?
Okay. So the signs that you mentioned, as I told you, less than 1 year, first the child should be able to make initially the should have a social smile, then also should have a joint attention. That's you show some third point, and then child should look at that thing and also look at your face how you respond to it. That's less than 1 year, and later on, as you see, the child does not make an eye contact. Child will not respond to your name call whenever you call to the child will not respond back to you. It looks like the child is lost in its own world. And some babies children will have repetitive movements, maybe hand flapping or a finger movement this way or a full body movement, and not attaining the speech that is required for the age how much it's supposed to attain. These are the signs and clues that are we need to evaluate for every child who's having a delayed deviancy.
And
But
who are the
yes,
people connected who can help
yes, definitely one person can never do justice to children like this. Uh,
professionals? Yes.
it should be a team, a multidisciplinary team of doctors, psychologists, plus we have the social workers, as you mentioned,
Educators.
educators, special educators, plus we have the occupational therapists, physiotherapists. All these people need to come together, sit down, and wherever there is a team and a team documents this child's status and progress, that is the best place, and that is the best thing that we can do for your child. Because these children, at the end of the day, we can't expect them to be CEO of some company or something. Tomorrow we have to include them in the society. So what is important to when we include them in the society? They should live with somebody else independently at their terms. At their terms. Maybe this child is autistic is living in somebody aunt's house in their terms, not auntie adjusting to his terms. That should be our ultimate goal in management of these children. So that is what is required at this point of time.
Okay. So thank you for being with us. It was great having you.
Yes, thank you so much. It was nice chatting.